schizophrenia or other psychotic disorder can contribute to this increased risk of violence. Some of it has to do with current active psychopathology, principally agitation, excitement, positive symptoms, delusions, hallucinations. But there are a number of other factors as well. Substance use, a very important modifier. The experiences I've had growing up, which may be related in part to the fact that as a child, long before I exhibited my first psychotic symptom, I was shy. I didn't relate quite as well to my peers. I've been deprived in terms of my learning experiences as a child. I didn't do quite as well at school. They contribute to an increased risk of violence. So it's important to understand the many different ways in which having schizophrenia might lead to an increased risk of violence. And there are some things we can clearly do something about as clinicians. There are some things that we need to address on a broader societal level, if you will. If you look at the profiles of persons with a psychotic disorder, again, the vast majority of these studies have looked at individuals with schizophrenia. If you look at individuals with psychotic disorder who have been violent, there are three broad profiles that emerge. A significant minority show antisocial behavior long before the first psychotic break, and that pattern continues. That is much more associated with minor violence, if you will. Minor violence is acts of violence that don't result in significant physical injury, that do not involve sexual assault, and that do not involve either threat or actual use of a weapon. So that's the definition that is used here in terms of the distinction between serious versus non-serious violence. The vast majority of acts of the pattern in those individuals with schizophrenia or other psychotic disorders who've been violent is that there was no violence until the first psychotic break. And then violence is continued in conjunction with active psychopathology and substance use. They have intersected to contribute to repeated acts of violence in those individuals. That's the vast majority. And in terms of very serious acts of violence, homicide, for example, as we noted earlier, almost half of the acts of homicide that you see in conjunction with schizophrenia occur before the first treatment for schizophrenia or other psychotic disorders. Now there is a third pattern which is very uncommon, which is no violence early on before the illness, no violence for the first 20 years or so, 30 years of the psychotic disorder, and then suddenly about 20, 30 years later, there's an act of violence, which can be fairly significant for some individuals. But that's a very uncommon pattern. Now, why is all this useful? Why is it useful as a clinician now to kind of be cognizant of this information about the association between psychosis and violence? Well, firstly, it's useful information to have as we participate in the public debate about the role of psychiatry in the context of societal violence. We can have a much more intelligent, informed conversation rather than waving our hands. Because there's a lot of hand waving, and the tragedy, really, I recognize the limitations of evidence and the limitations of information. We don't have information on everything that we need to have information on. On the other hand, we do have a substantial amount of information that can be useful in guiding us towards effective ways of addressing problems that we need to address. And so if you look at what we know, violence and psychotic disorders, what are the major elements that drive it? Personality disorder, psychopathy, a significant factor. Substance use, a significant factor. Delusions, hallucinations, positive psychotic symptoms, a significant factor. mentalizing difficulties, the issue of empathy, the deficits in theory of mind, an important factor. Treatment-relevant issues, not complying, not adhering to treatment, or not being treated at all early in the course of psychosis, a very important factor. And other clinical features, history of abuse, history of homelessness, history of being victimized violently, the history of sexual abuse as a child, those factors contribute to the risk of violence. Now let's get back to our roles as individuals.